Okay, Tony, third time lucky.
It's third time the charm. Thank you.
Brilliant. So we are going to have to do a slightly condensed version of this due to our slightly technical problems, but I'm sure we'll still get the message across.
Absolutely.
So the first thing I want to say is you have a fantastic last name. When you came up in my my list of people to interview, I was like, that's such a good name.
Well, in truth, I cannot take any credit for that as my parents, but yes, thank you. I appreciate that. I like it.
So let's just jump straight in. So what inspired you first to dive into digital transformation and obviously eventually then write about it? And how has it shaped your perspective on healthcare?
So I've been doing digital for, in addition to technology, of course, for a very long time. And what we started doing is, what we call now digital is really about customer experiences, building customer experiences, and with the goal of exposing, self-service capabilities to users, consumers, patients. Now, at some point in the journey, I think it kind of became clear that digital needs to be more than just useful, very useful, but just interfaces, and rather drive the transformation of processes, operations, and even business models at some point. Obviously, that has happened with e-commerce. You remember where we started there, but and then that. And all these in the supporting the customer needs, customer user, and as I said in the book, what we did is a lot of us used the customer experiences at the edge of the company and then the front end of the company, as a way to kind of pull the thread of transformation inside the company. So that's the transformation part. And you mentioned my book, Doing Digital. That came out of the realization coming from conferences and sessions like this that a lot of folks were struggling to understand what digital transformation really meant. So I might as well decided to write a book.
Brilliant. And I guess that digital transformation has changed a lot since, well, with every single thing that's happening, it's just getting bigger and faster and easier for you to shape customer journeys.
Oh, absolutely. So you're right, and then that changes every day. I wrote the book just about when ChatGPT was coming out, and I did write about it in the book, but now it's a whole different dimension. But however, at least from a a healthcare perspective, I don't know necessarily that things change, maybe to a large degree, but that essence is still there.
So when you look across healthcare as a whole, what's the biggest challenge organizations face in moving from just doing digital to being truly digital and it helping actually transform those end consumer results?
Healthcare is in the United States, healthcare is I don't want to say that, but it's true. It's a $5 trillion industry. So it's huge. It's incredibly complicated. And it lies at the intersection of so many actors that have different incentives in a positive way, but they're still different. Healthcare has been so insular. And I came into healthcare in 2020 in the middle of the pandemic, believe it or not, because I thought, okay, if I'm to make a difference, that's the time to do it. It's been so insular for so long compared to the rest of the economy, and therefore it started the digital transformation, even in the data, years or maybe more than a decade after others. I'm pretty sure probably today there are still hospitals trying to do what we did in finance 15 years ago. So I would definitely suggest everybody to continue on that digital transformation, just layer on top other dimensions, like AI. But in reality, the digital transformation is not just an app or a website, although doing those, it's important, and that therefore my book, but really into the rethinking internal processes and operations, course, outside the pure medical procedures. We don't go there, to simplify, streamline, and operate differently.
Yeah, you don't want to simplify heart surgery.
I'll trust the doctors absolutely fully, but everything around it in terms of operations and insurances and all that stuff can be transformed and simplified.
So you mentioned obviously starting on a back foot, really. So everyone else was kind of a couple years ahead. Was that a big task to catch up?
Oh, absolutely. And I think it's more than a couple of years behind. I think it's a huge difference. But sometimes that's an advantage, because you learn, all the lessons. That's why I came from outside the healthcare, and others like myself. All the lessons and the dead ends that we all encounter somewhere else, and you just kind of try to jumpstart. But it wasn't easy, because this is a different mindset, more than just technology. Technology at the end of the day is just a tool. I know some folks may, especially in the AI space, want to look at that as something very, very different, but it's just a tool. How we use it is important, and how do we do change management? We introduce technologies, especially in healthcare.
Brilliant. So we're looking at a best-in-class customer journey today. So what does that look like as a digital healthcare journey from a patient's perspective?
So what we need to do from our side is really make sure that whatever experiences, whether it's an app, a web, some sort of a chatbot, we guide the patients, and we simplify for the patients in a way that it's very natural. I think it was Arthur Clarke who said, any technology sufficiently advanced feels like magic. So it's kind of transparent. So how do you not put the patient in front of all the details that they don't really need to know? So that would be a huge thing. Clearly with AI, which has to be done very carefully and thoughtfully, it can help immensely with process simplification at the other end, and making the experiences more intelligent, and simplifying in a way that it's more flexible, versus kind of going for a process just because that's how it was coded, and clearly make it more individualized.
So what would that look like then? What is that journey? How would, give us an example of that.
The examples are plenty, and they're very simple. And there is an initiative that CMS has that says kill the clipboard. And they're not talking about just the physical, the paper clipboard. It's about not asking patients for information that the provider should already have, whether it's by obtaining it in the back end for exchanges, whether it's obtained at the front end. Why do we still ask that? It's such a simple example, but if you extrapolate that, because we have it, or where we're going is with health apps, a variety of health apps. If my entire information is there, that's easy to share. Therefore, we don't need to burden the patient with all those things. Yes, sure. Or sometimes things have happened basically maybe in the last 24 hours or whatever it is since the information was available. But other than that, I went over the weekend to get a new pair of glasses. There was a 33-page form that asked for everything beyond that, and I just asked, well, what's the deal with that? Because clearly you're not cared. You don't care about all the other things. Well, they said, well, that's how the system that we're using, it asks for everything because it's a generic system. There you go. It's a very simple question, very simple answer. We can do a lot better.
It's a very good point. I mean, everywhere in the UK, obviously our health service is different, but every single healthcare professional you speak to, you ask them the same questionnaire, the same answers, and it's just a loop, isn't it? If we can streamline that process, then we've got the tech to do it now.
Absolutely, and that's just what the patient sees, but there are a lot behind that can be simplified, and that would also reflect positively on the patient experience. So
talking about those efficiencies then, obviously digital tools bring the efficiency, but how do we also ensure that they create a meaningful and human experience for the customer?
Well, so I think it's clearly we've known how to make things more efficient in terms of internal processes in whatever industry. I think we need to secret sauce is actually very not so secret. Is when we look at things that touch the customer, we need to be maniacally focused on that and start from there. Just because something is efficient from an internal perspective, it doesn't mean it has to leak into the customer experience. So we start always with the customer and go inside. There are always ways to automate with AI or without AI internal processes, but if we start with the customer, then the solution will be better.
Brilliant. And finally, let's look to the future. So what bold steps should technology leaders take today to ensure digital transformation leads to lasting impact?
I think it's very important is to start looking at all the processes, all the experiences, and start rethinking them all. And in a way that would be, if they were to start from scratch, start a new practice, it's GP, PCP, whatever. How would you design those things in order to be good for customers and useful for customers? I think that's what I would recommend. It's very hard thing to do because there's all sorts of history, and you have the HRs, and you have the portals, and you have whatever else. But I would say start rethinking all those. There will be situations where people will discover that things that have been done for 20 years that actually not necessary. Maybe they haven't been necessary 20 years ago, but they're definitely not necessary. So rethink the operations. And that's just not just for the past customers, will have good benefits for providers and other players in the healthcare.
So I guess then what is one thing that you would have known or that you would have wanted to know when you started your digital transformation journey?
Digital and transformation in general or in healthcare?
In general, or I mean in healthcare, let's start in healthcare.
In healthcare, obviously when I came in healthcare, I've been doing this for quite a while. And maybe it was a little bit arrogant in the sense of I must have seen everything. And I've been surprised ever, especially in the healthcare, in the provider space, I've been surprised all along. So that's what if I would go to 2020 and tell my younger self, it would be prepared to be surprised. But a lot of it is driven not by ill intent or anything, is that isolation and siloing where a lot of entities in healthcare have been. And there was a fair amount of education coming from the outside that was very beneficial for me and others like me to bring.
Brilliant. Well, thank you, Tony. You've brought us right up to time as well. So thank you so much for joining us today.
Absolutely. Thank you. Sorry about the technical difficulties. Sometimes even the technologists have those.
Yeah,
so.
You don't expect it from a tech and an AI event, but here we are.
Yes.
Brilliant. Well, thank you so much, Tony. Lovely to speak to you.